According to current statistics, 50% of all mental disorders in Kenya start by the age of 14 years and 75% by the age of 24. This clearly indicates that the youth are the most affected in the society.
Watu wa kawaida ambao wako huko mashinani, asilimia 11 kwa 100 wana ugonjwa wa kiakili lakini hawajui.
I dare say if I asked members in this room if the nearest health center to your house where you live, back home where your grandmother is, if there are mental health services, I'm not sure if any of you would say yes or no. For me, it's a Kenani Health Center. I know my health center and I know there's no mental health service per se there that's available.
The World Health Organization says people with severe mental health conditions are likely to die prematurely.
Many mental health conditions can effectively be treated at relatively low cost, yet the gap between the people needing care and those with access to care remains substantial. Effective treatment coverage remains extremely low in many countries, including many parts of Kenya.
The COVID-19 pandemic has introduced financial and psychological effects in the society, which is linked to the rapid increase of cases of mental illness in Kenya.
When you go to any health center in our country, any health center, the people who are attending your nearest health center this morning, 25 to 30% of them will attend the health center, not because they have malaria or TB, but because they have, in addition to all that, a mental health need. The fact that they are not recognized does not mean that it is not there.
With the newly launched National Mental Health Action Plan 2021-2025 come solutions to the decades-old illness. An example is additional funding, as up until the current financial year, mental health received only 0.01% of the national health budget.
Government has very happily for us allocated 200 acres of land around Ngong area for us to move Mathare Hospital from where it has been since 1911. And shortly, I can't say it's next week or the week after, but in the course of your lifetime for sure, Mathare will relocate from its present site to a new site.
So we wouldn't just have Mathare as the lone facility that's offering referral services. We'll try and create linkages across the country, regional linkages, that also then link to county services and eventually to community services. So a lot of work is happening right now.
It is estimated that in the 2021-2022 financial year, mental health shall receive 2.3 billion Kenya shillings allocation, up from 1.8 billion shillings in the current financial year.
We've set about different interventions that include ensuring that we have more health workers who are trained in mental health services, in ensuring that these services actually become devolved from the higher levels to the lower levels, ensuring that we shine a light of primary health care when it comes to mental health services, and also most importantly, ensuring that the whole contingent, the stocks of medicines that are required are available.
Ben Kerera, K24, Evening Edition.